At the CDC, we saw a panel of self-styled independent thinkers who are all RFK allies take away the birth dose of the hepatitis B vaccine, a strategy which has saved thousands of infections per year, and therefore the long-term consequences to those babies, which is liver disease, which is eventually cancer and death. So the president, RFK, and the committee that RFK put in place at the CDC is absolutely wrong. Do we want to have more infections? This policy that they put out today, tragically, will achieve that. And it's horrible because we have such good science to say that the 3-dose vaccine series, including a birth dose for every baby, has solved the problem. It really solved the problem, Anderson.
Well, let me ask you, because the president said, well, it's sexually transmitted, so why would you give it to a newborn? Can you explain how a newborn could get hepatitis B from exposure, contrary to what the president said?
So the mother can get hepatitis B at any time and give it to the infant. There can be vertical transmission during pregnancy. There can be horizontal transmission, meaning when the baby gets home and they are exposed to people who have the virus or who acquire the virus at any time. And that happens not often, but often enough that the targeted strategy fails. When we got away from the targeted strategy of just going after high-risk babies and vaccinating them, when we replaced that with vaccinations for all babies, our incidence, the number of cases of hepatitis B, virtually vanished. So he's just wrong that this is not a concern. We've seen there was a prior attempt with that, and it failed.
Do you expect pediatricians will still recommend newborns get the Hep B vaccine at birth?
They should. But the problem is that pediatricians and other healthcare clinicians are very busy, and now parents are going to have this in their ear of, oh, the CDC no longer thinks this is necessary. I have questions. And we know that this will decrease uptake. We know that when the CDC weakens recommendations around its vaccines, that uptake goes down and disease goes up. So unfortunately, nothing this administration has done has made vaccines more available. They've made it less available. They have emphasized these theoretical harms that they're basically anecdotes that the data don't show, and they de-emphasize these incredible clinical trials that show the benefit over and over again. And we're seeing it drip by drip that Secretary Kennedy is doing what we thought he would do, which is to undermine our vaccine apparatus. Senator Cassidy is a smart physician, but he made one of the most irresponsible and costly decisions in American medical history when he put a vote in to confirm Secretary Kennedy.